Cut 2.
Yay! Hi, Miss Williams.
Hi,
My
how
name
are
is
you?
Ashika. I'm going to be your PA today. How
Nice
are
to
you?
meet
You too. So I looked at your charts and everything, and I saw that you're coming in for your daughter Amy. She's 6 months old. She's having a lot of like ear infections. Can you just kind of describe that a little bit more?
Yeah. So I don't know if this is relevant, but I just want to like, get it out there that I'm a single
Sure.
mother.
Okay.
And yeah, I came in today because my daughter Amy, who's here for a 6-month checkup, has had several inner ear infections over the last few months, and has just been I have been diagnosed with the same condition. So I'm getting all these crazy ear infections, and I don't know like why I'm getting them.
Yeah, okay. So when I was also looking at your chart, I noticed that you are a smoker. How long have you been smoking?
So I've been smoking since I was 12.
Oh, wow, okay. And have you ever considered, like quitting smoking at all? Are you interested in that at all?
I don't know. It helps me deal with my problems and cope with the stress of being a single mother.
Yeah, no, definitely. I can't even imagine, what that's like. But I just want to bring up the smoking because I do believe that, the secondhand exposure that your daughter is getting from the smoke is probably what's causing these infections. And you said yourself you're also getting them.
So you're saying when I smoked during the pregnancy, that was bad for her?
Yeah, that was pretty bad. You did smoke during the pregnancy?
Yep.
Yeah, so I don't know who your primary care provider was or your OBGYN, but I don't know, did either of them speak to you about smoking cessation?
Yeah, my obstetrician.
She did.
It's a long name, obstetrician. But
Yeah, obstetrician.
they recommended that I stop smoking, but it was
Okay.
just too tough for me.
Okay.
I've been doing it ever since I was 12.
Sure, no.
One pack per day.
One pack
Keeps
per
the
day.
doctor away. Till
I
now.
don't know about that. But no, I'm glad they did bring it up. I do understand that, taking, something like smoking that's been a habit in your life for so long, trying to take that away, even if it is a negative habit, is really difficult. But I, do want to bring it to your attention because I really do think it's the cause of the infections. And even if, you're not, ready to, quit anytime soon, just to start thinking about that, for your daughter, not
Yeah.
even,
I get
just for
that.
you, because, cigarette smoke, so many of the chemicals in there, are, cancerous. So, that's more towards your health and also your daughter. And you smoking around your daughter is also more likely to make her a smoker, more likely to cause respiratory infections for her. And, at her age right now, at 6 months, she's extremely prone, to lots of different conditions and illnesses and things like that. And, I'm sure that you want your daughter to be happy and healthy. So just something to consider.
So I'm concerned more about what's the cause of these infections. My daughter had these infections. I just started getting ear infections.
Yeah, so can you
What's
just
the deal?
describe that a little bit more? So when exactly have they started? Kind of fill me in on the history of them. Has it been
my
recent?
daughter Amy has had several inner ear infections over the last couple months, and I've just been diagnosed with the same condition. So yeah, that's all I know.
Okay, well, I don't exactly know, what may be causing them. I do think that the smoking probably has some factor in it. But do you have any other past medical history that I should know about?
Like what? No.
I mean, have you ever gotten ear infections before?
Well, I don't use other drugs. I'm just gonna say it.
Okay.
I don't, and I only drink wine occasionally.
Okay.
Yeah, I mean, overall, I don't have any past medical history. No meds, no allergies.
Have you ever had any ear infections like this before? You said you've been smoking since 12.
Not that I know of. I
Something
mean,
you know
just
of.
little Amy, that's all. Now
Okay.
me. And my mother actually smoked 2 packs a day for over 30 years. And my father smokes but is not in the household. And my parents are divorced.
Okay.
My mother's current boyfriend is a smoker and frequently stays at the house for long periods of time. Your baby's father is also a smoker. So everyone's a smoker. To be
Okay,
honest.
I
That's
see.
the problem.
So I really do think then that kind of brings us back to the concern of smoking.
Yeah.
I just think that it's so much exposure to smoke, and all those chemicals in there, are not good. They can, cause ear infections. They can cause respiratory infections. They can cause a multitude of problems. So I do think, do you notice that maybe when you're, away from the house, I'm not sure if you're working currently, but even if you're at the grocery store for like a few hours, or you go to the mall with your daughter for a few hours, if you notice like kind of a difference in like the severity of your symptoms, have you noticed any difference?
I think this is so recent. I mean, my daughter Amy had 3 inner ear infections, which were diagnosed, but it's only been recent since I started getting ear infections too. So I can't give you an honest answer onto like the effect of that. But I mean, I smoke at the mall. I smoke everywhere. So really,
So
the exposure is
kind of
constant.
always there.
Yeah, it's always there. It doesn't matter whether I'm home or not home.
And have you gotten treatment for the ear infections for you and your daughter?
My daughter got some drug. I don't know what it is. She just took it. That's kind of why I'm here today.
Okay.
But I think it's also time for me to kind of own up and maybe consider smoking. I don't know what alternatives or what things you could offer.
There's so many things that I can offer too. First of all, the biggest thing is support. I know that you said that you've been smoking since 12. That's a long time. So just stopping smoking right away is just not possible. It's just not realistic. So I'm here to help you kind of work through, and we can make a plan for you. If you're really, interested in quitting, then we can talk more in terms of that. Right now, if you're just interested in finding out more about, maybe options to consider, and we can just kind of talk about options, and we don't have to, set any sort of date or anything. So what I like to do with a lot of my patients is I like to set like a quit date. And that's usually when they come in to see me, I usually pick a quit date, probably like 2 or 3 weeks kind of out into the future. And up until then, like they come in and see me and we kind of talk about, different ways that we can start to, limit their, smoking and, what other lifestyle changes that they can, make before we, try and quit. But there are so many other options. Are you currently, breastfeeding your daughter, or is she on like formula? Because I can offer you some sort of drugs to help you wean off of the medication, but they are contraindicated if you're like breastfeeding or in pregnancy.
I'm not breastfeeding.
You're not breastfeeding.
Yeah.
Okay, so that's definitely an option. They have like patches. They have gum that you can chew. So they do have some nicotine in them, but that can definitely help. You work towards, being able to stop smoking. So that's definitely a start.
Yeah, sure.
But the benefits of smoking, are great. Within a day, like your heart rate is lower. Benefits of quitting smoking.
Oh, okay.
Within 24 hours, your heart rate lowers. Smoking is, it ramps up everything in your body. So it kind of, taking that away would be extremely beneficial to your body. And I always like to tell my patients, I know it seems like a long time, but, in 15 years of not smoking, you end up being the same risk as someone who never touched a cigarette, which I think is pretty amazing.
That's crazy.
Yeah. So do you have any other questions for me? I know I threw a lot of information at you.
No, you've been so nice and everything to help.
No, definitely. I
Do
mean,
you
that's
do you
why I'm
reckon? Are you
here.
gonna do anything for the ear infection or what?
Yeah, no, I can definitely prescribe some medications for that.
Okay.
So I could definitely prescribe some for your daughter and then some for you as well. And I'd like to schedule a follow-up visit so you guys can come back and we can kind of talk more about the steps that you want to take to quit smoking. So you said you are a single mother, so I definitely understand. There's a lot of barriers and things like that. So I'm more than willing to work with you and kind of meet what your lifestyle
Great.
needs are.
Thank you. I appreciate all your help, and hopefully I get better, and hopefully my daughter gets better.
Of course, I'm sure
Yeah.
she will. But
Yeah.
do you have any other questions or anything for me?
No, I'm just excited to start trying to quit.
That sounds
Yeah.
good. So do you think the gum or something like that would be something that you'd be
Yeah,
willing
I think
to do?
it all sounds good. Just give it to me all. I'll take gum. I'll take patches. I'll take anything.
Okay, that sounds
Yeah.
good. And I'm sure more than anything, I really think that your daughter will be really proud of you, when she grows up and,
I hope.
realizes that, you decided to make a really big lifestyle change. That's really important.
Yeah. Well, thank you. It's been great to meet you.
Of course, you too.
Yeah. Thank you.
Please let me know if you have any other questions or anything. And I'm going to go and write the scripts for your
Okay.
infection.
Great. Thank you.
Bye.
Bye.